Hi guys, welcome to eMedicard, an integrated holistic health platform. And I'm Dr. Abdul Muttalib Khan, your functional medicine specialist and currently pursuing dermatology. So today I'm going to deep dive with you into understanding if intermittent fasting has any role in the treatment of diabetes. So what is better than directly understanding from the clinical database and endocrinology site, and where they have done a systematic review of the literature in February 2021 and created a guide for primary care physicians. So what was the literature they have reviewed? The literature they have reviewed is the clinical trials data, review articles, and case series related to type 2 diabetes, insulin resistance, and intermittent fasting. And what they did, they have searched that on various sites, popular research oriented sites like PubMed, Ovid Medline, and Google Scholar databases. And what they found, the results were nothing short of amazing. The majority of the available research demonstrated that intermittent fasting is effective at reducing number one, body weight, decreasing fasting glucose, decreasing fasting insulin, reducing insulin resistance. And here, the major problem in type 2 diabetes, which I have been repeatedly keep on telling, is insulin resistance. So we need to understand. So just by focusing on the blood glucose level, it's not going to do any good to patients who are suffering with insulin. And physicians are making by giving these patients tablets, they're making uh, look this diabetes as a progressive disease, which is not a progressive disease, right? So what was the conclusion of this systematic review, and what was the guide they have given to the primary care physicians on intermittent fasting? So results, we just discussed the results. Now the conclusion what they gave, and they suggested that intermittent fasting is one of the most effective non-medicinal treatment options for type 2 diabetes. And they suggested that physicians should consider educating themselves. I hope physicians are listening to me. Physicians should consider educating themselves regarding the benefits of intermittent fasting, right? And they suggested diabetic patients should consult their physicians prior to starting intermittent fasting regime, because that will give them appropriate oversight, and that will help them in titration of their medications during the periods of fasting. So this is what eMedicals comes into play. So we provide many programs through our platform. Program like reversing type 2 diabetes and immune repair program. So what we provide is completely one-to-one support. So what is one-to-one support? So we provide in one-to-one support. There's a patient who's seeking to reverse type 2 diabetes. In the WhatsApp group, there's one patient there, one doctor, and one dietitian. So the only three people will be there. So our focus is completely one-to-one to the patient who's seeking to reverse type 2 diabetes through eMedicard platform. And I suggest, before you decide, I suggest you to come to our website emedicard.co.uk and go to the consultation page, and you can book your free consultation there with us and speak to our doctors for half an hour and understand how easy it is to reverse your type 2 diabetes. It is really easy because we have so many patients now where we have even reduced the A1C from 10.1 to 6.4 in just span of three weeks. Can you believe? It's unbelievable. I strongly suggest anybody who's watching this video to please first take the free consultation with us to understand how easily we can reverse type 2 diabetes. Thank you for watching this, and I request you all to forward this video to your doctors, and to the people who are suffering with diabetes. Thank you.